Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Hazra Izzati binti Hussein and my partner Siti Najihah binti Jamil and Stanley Will anak Enturan. Today we will present about the drug in sport. Okay, what is drug in sport? Drug in sport is the use of drug to improve their performance in sport. Doping is defined as use of drug of other substances for performance. Okay. Drug in sport is the use of drug to improve performance in sport. Doping is defined as the use of drug of other substances for performance enhancement. A handful of popular athletes take drug to gain a competitive advantage to improve their performance. This is three drugs that are often taken by a handful of athletes. The first drug, anabolic steroid, stimulants, and cannabinoids. Mechanism of doping has 6 categories. The first category, strength enhance, output of energy, hand steadiness, body fluency, and endurance, and the last, weight reductions. Okay, for the first strength enhance is photos athlete want to improve their strength, like sport weightlifting, wrestling. They will take this kind of drug, their strength, weightlifting or wrestling, uh, like rolling. Output of energy. Athlete want to increase energy to they can reach target like sport 100-meter sprint. They will take drug like amphetamine or cocaine. For the hand steadiness, sport shooting or archery, athlete will take drug like beta blocker. For the body fluency, sport gymnastic, they will take drug like growth hormone to keep their body fluency, because the nature of this drug is to stimulate growth and cell repair. To increase endurance, athlete can take erythropoietin. The sport that will take this drug cycling or marathon. For weight reductions, to lose weight, like the sport boxer or joker, this sport requires an ideal weight. This is a list of prohibited. Has 3 category. For first category is substances and method banned all the time. Second, substances banned in competition, and the last, substances banned in particular sport. Okay, substances banned all the time. This is 6 category. First category, non-approved substances. Example for drug is drug under preclinical development discontinued. Category, anabolic agents. For the example, danazol or clenbuterol. Category S2, peptide hormone, growth factor related substances and mimetics. The next category is beta-2 agonist. Okay, for the example, prometheral or phenytoral. Second last category is hormone and metabolic modulator. Okay, for their example, aldosterone. Okay, the last category is S5, diuretics and masking agent. Okay, for the example, this phosphicin and probenizine. Probitic method, this has three category. First category is manipulation of blood and blood component. Second category, chemical and physical manipulation, and the last gen and cell doping. Okay, for the manipulation of blood and blood component, this category refer to blood doping, including the administration or introduction of blood or red blood cell products of any origin into circulatory system. It also includes artificially enhancing the uptake, transform of or delivery of oxygen, and intravascular manipulation of blood or blood component by physical or chemical means. Second category, chemical and physical manipulation. This tempering or the to temper in order to alter the integrity and validity of sample collection during doping control is prohibited. This include but is not limited to urine substitution and alterations, intravenous infusion and injection of more than a total of 100 ml per 12-hour period, except for those legitimately reserved in the course of hospital treatment. Sur- Surgical procedure or clinical diagnosis investigations. The last category is gene and cell doping. The transfer of polymer and nucleic acid or nucleic acid analogous, and the use of normal or genetically modified cell prohibited. Use of normal or genetically modified cell.
For the substance prohibit in competition, first is acid stimulant. For the example is we can see the most we ever heard there is cocaine and amphetamine. For the S7 narcotics, the example is methadone and hydromorphone. And then the S8 cannabinoid, the example is natural cannabinoid, such as cannabis, honey, and marijuana that normally athletes use for their treatment or rehab. The second example is the synthetic cannabinoid, such as terahydrocannabinol, cannabidiol, and then S9 glucocorticoid, which is the example is cortisone and fluticasone. Third substance prohibited in particular sport is beta blocker. This is used for the sport like archery, automobile, arts that the athlete want to increase their precision when they are do to shoot their main target. And then this is organization that we control the anti-doping. First is World Anti-Doping Agency, which is WADA. This is the first anti-doping agency that been done in the world. This WADA is established in around 1999, and their HQ WADA is in Canada, Montreal. This WADA composed and founded equally by the sport movement and government of the world, just like everybody that want to involve in the sport or the competition, like Olympic and the others. Their activity is more to scientific research, education, develop of anti-doping capacities, and more monitoring the work of anti-doping code, which is they will be the first investigator to investigate the athlete that have problem with their doping. And second is NADA, which is the National Anti-Doping Agency, were established in India, but registered in society in 2005. In 2008, which is March 7 March, they accept the World Anti-Doping Code, which is their work together. This is the advanced effect of doping when the athlete use. First is general side effect. The athlete will have a grisky skin and ends will be hypertension, and maybe then they have a tumor. For the male specific effect for the male athlete, they will have a pattern in their hair, which is grow and baldness. They will also have a testicular atrophy and impotence. For the female athlete, they will have a menstruation disturbance and decrease the size of their breasts, and maybe will cause their deeper voice. The effect, hormone and related peptide. For the EPO, this is example for the drug. We make the simple one. EPO will increase the volatility of their blood. Maybe they will have a hypertension and concoction. For the SGF, the athlete will be have the acromegaly. Their tissue will soft, and maybe they have the arthropathies. And then the insulin drug, they will have a nausea, drowsiness, and hypokemia. For the HCG, they will have a menstrual disorder and gynecomastia. For the ATCS, athlete will have the insomnia. They will get hard to sleep, have problem to sleep. Maybe they have a diabetes mellitus and also stomach ulcer, and maybe cause their bone osteoporosis. And then for the third one, effect stimulant, this will be come after they are consuming the stimulant drug. Maybe they will have a cardiovascular malfunction, which maybe can give them death or cause death. After consuming the stimulant, they will have some issue, which is lost their appetite, insomnia, trembling, and hypertension. This is the investigate for process which is formed by WADA or NADA. First of all, they will receive the complaint by the any athlete or the organization. After they receive the complaint, they will collect the information from the other sources that can be used to make sure the athlete use the drug, such as information from friend, parent, official, and other athlete. They will interview with the person who claimed the issue, and the person need to give the evidence that can be their proof that athlete is use the drug to improve their performance. After collect the sources, they will analyze any uh, anything that come with the evidence. They will analyze or use sample the sample that they have and do the certificate uh, from the day of the evidence come to their place, and then the certificate they will form a team that will organize this certificate to make sure that everything is clear and the athlete is uh, used to use the drug or not. And after collect the evidence, they will come to conclude if the athlete is wrong or right, use the drug or not. They will conclude and they have will inform the organization of the sport with their evidence. That is their process certificate. Uh, this is all from our group. For our quote is pain is temporary, pride is forever. Thank you.